Other news at this hour, patients at Bedford Orthopaedic Facility in Mthatha in the Eastern Cape have expressed concern about the poor state of the hospital. The hospital, which caters for patients with muscles and bone deformities, is overcrowded and the building is also dilapidated. Some patients who have to travel almost 200 kilometres to reach the hospital say that they spend days or weeks waiting to be assisted. SABC News reporter Nkululeko, Nyembezi and video journalist Sinethemba, Bllandile filed this report.
Coming live from Bedford Orthopaedic Hospital here in Mthatha. You'll remember that last week there was an outcry from outside that this hospital here is overcrowding and then is dilapidating. But it was just an outcry from the people that were attending this hospital. But today we've decided to just come to this hospital and find out what is actually happening. I'm now joined by Dr. Sizwe Kupelo, who's a spokesperson of the department. Dr. Welcome to our show. For sure, you heard the bad news. In fact, it was like a trending news last week that this hospital here is overcrowding and dilapidating. Maybe what could be the reason for that? If you can just maybe take us through.
Well, it's two issues. The services that are required by the patient. If, for instance, we can address the issue of last week, the patients that were photographed had already been seen by our clinicians. They were only waiting to be taken by transport patient vehicles back to their respective hospitals. This hospital is serving a number of peripheral hospitals, so those patients are referred to this for orthopedic services. In as far as infrastructure is concerned, it is an issue that is high on our agenda. In fact, as I'm talking to you now, a tender worth 7.4 million has just been awarded to attend to emergency issues. We also had an issue with the supply of water. It's an issue that's been dealt with, also working with the municipality. But from our side, we addressed it by resuscitating the boreholes that are servicing the hospital. We've also looked at issues of air conditioning system within the facility. Unfortunately, the people that you see are coming from the peripheral hospitals, but our clinicians are ensuring good they get seen. And then you've got the issue of bed availability and the speed, which would be addressed by our CMO in as far as how that service is done. But we've also bolstered HR here to ensure that we give them additional doctors so as to fast-track operations.
So maybe is it correct to say this particular institution is still lagging behind in terms of providing quality healthcare service? Looking at the infrastructure is dilapidating.
No. We are providing top quality service because we've got specialists that are serving here. So the kind of personnel that's serving patients here is above board, and the services that are rendered are also of high quality. Our main challenge is the physical infrastructure of the building, which is being attended to. We've got partners as well that are also trying to assist. For instance, Road Accident Fund has also committed to assist in attending to some of the infrastructural issues that are being experienced here. And we've got teams that are coming also to assist in further assessing what other interventions are needed. But there is no doubt about the quality of service that's being received by these patients. The issue is that the population that is being served by Nelson Mandela Academic Hospital, because this hospital forms part of the central hospital and it is a referral hospital. So these people that you see here are not only coming from surrounding communities, they've been referred from various hospitals.
Thank you so much. That was Dr. Sizwe Kupelo, who's a spokesperson for the department. But now let me talk to Dr. Nyembezi, who is responsible for some of the operations here at this hospital. For sure, you must be very shocked when you heard those news that there were people that were reported that there were there were delays in terms of conducting operations and stuff.
No, thank you very much. I do think that we have problems with delay. Most of our problems come from infrastructural issues, as already Dr. Sizwe Kupelo has alluded to. We've got disruptions in the water and the electric supply to the hospital. If I give you a background of this hospital was built as a missionary hospital, which was through Professor Makonaki. So initially there was not a mushroom. The problem was the mushrooming of informal settlements around this area, and hence the water system which was dedicated to this hospital. So there were a lot of legal connections. There's still a lot of illegal connections that hampers our ability to perform and to operate timeously these patients. The issue of electricity has been also a problem which contributes to the delays. If we've got a generator sometimes which works, sometimes which doesn't work, but as you have heard before, that now those issues are things of the past. We suspect that, and we hope that we are going to be past that stage where we've got disruptions. When this hospital is functioning adequately, this hospital is a 189-bedded hospital. We work at full capacity. It produces around 200 cases of orthopedics a day. And mainly what we see here is orthopedic trauma. Now, if we look at the burden of disease, which is in the Eastern Cape, I have to first talk about the human resource issues. This hospital has got 4 consultants. We've got a population of 4 million, which we are serving. So it's 1 consultant per million. The problems is also because we are a rural hospital and we are in the rural part of Transkei, it is difficult to recruit and retain specialists, because these specialists, when we recruit and retain them, orthopedic specialists, they are high demanding everywhere. So instead of leaving the bright lights of Johannesburg and the jacarandas of Pretoria or the warm sea of India, the Indian Ocean in KZN, there's few who want to settle in the Eastern Cape. There's also an issue of the fact that the consultants which we are recruiting are young consultants with very young children, and we have to answer things like, where are their children going to be attending school? Do we have the necessary things to retain them? It becomes a problem. I'm going to address another problem. The other problem is that, look, the burden of trauma we see is not only, it's a societal issue, because we know that through the increase, the COVID period has taught us that if alcoholism is less, we see less trauma, right? And also the issue of adequate traffic control and police control, because with adequate functioning of those departments, we are able to decrease the burden of trauma, and I think we are, as a Department of Health, we are just the end product of all these societal issues, and that's what really is the pain. I don't know if you want to ask.
Okay, let's talk about this, because there has been a lot of talks about delayed operations and stuff, but I just want you to touch on that before we wrap our interview.
So, as I'm saying that the delayed operation is a functioning theatre, and theatre is functioning on electricity and water. So if we have a disruption in those, that leads to cancellation of patients, and that needs to delay in patient care. As a head of department, it really pains us to see these delays in people getting the adequate management, which we know that someone with a broken bone the maximum time should be 48 hours, right? But because of the delay, these disruptions we have in the provision of electricity and water, which are not in our control as the Department of Health, that then delays us getting. The average time will be around a week for a patient to get to theatre, right? Which is not according to at least the international norms of two days for a patient who's got no comorbidities. If you've got other illnesses, right, medical illnesses, of course we need to take care of those.